This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Dydrolady Art Tablet is a medication used to manage progesterone deficiency in women. It provides relief from menstrual pain and symptoms associated with hormonal imbalance. Indications and uses. This medication is indicated for the relief of menstrual pain, management of endometriosis, and alleviation of premenstrual syndrome symptoms. It plays a significant role in supporting overall female reproductive health and is also used in postmenopausal women to relieve menopausal symptoms when combined with estrogen therapies. How it works. The active ingredient, dydrogesterone, works by supplementing the body with adequate levels of progesterone, which helps to regulate menstrual cycles and supports the uterine lining. Directions for use. Take the tablet as prescribed by your physician. Swallow it whole with a glass of water without chewing or crushing the tablet. It can be taken with or without food, and it's advisable to take it at the same time each day to maintain consistent levels in the body. The dosage will be determined by your doctor based on individual factors such as age and medical condition. Possible side effects. Common side effects may include headaches, nausea, breast pain, and irregular menstrual periods. It is crucial to consult a healthcare professional if any side effects persist or worsen. Precautions and warnings. Prior to using this medication, inform your doctor of any existing health conditions, especially liver problems, depression, or if you are pregnant or breastfeeding. Regular monitoring is required to avoid potential complications, and you should not use this medication if you have a history of certain tumors or blood clotting disorders. FAQs. 1. What is Dydrolady Art Tablet used for? It is used to manage progesterone deficiency and alleviate menstrual pain. 2. How should it be taken? Swallow the tablet whole with water, as directed by your doctor. 3. What are the side effects? Common side effects include headaches and nausea. 4. Can I stop taking it if my symptoms improve? No, always consult your doctor before stopping any medication. 5. Is it safe for children? It should only be prescribed for postpubertal girls aged 12 to 18, as advised by a doctor. Thank you for watching our video. If you have any questions or suggestions, please feel free to comment below. Your feedback is always appreciated.